Hello, everyone, and welcome. I am Dr. Andrew Neville, coming to you for our live Q&A here on various platforms. So the first thing I want to look for is a little check-in with my team to let me know that audio and video is working on the platforms, just so you can give me a heads up there, which would be great. Thank you very much. And then I've got to do just a couple of housekeeping things quickly first, and then I'll get right to your questions. So I want to welcome everyone, right? If this is your first event, right, or if you've been to dozens of these to learn, I'm really glad you're here, right? Because our purpose is to have a conversation about adrenal fatigue, what it is, what it isn't. You know, these people say it's not real. These people tried to treat me for it. Didn't like, let's dispel all that stuff and let's get ahead of it, right? A lot of people who submit questions, so I've got this list of questions. So a lot of people who submit all those questions, they've already tried 10 things, 20 things, 100 different things to fix their symptoms, maybe adrenal fatigue or maybe just the secondary problems, right? They've been tracking, they've been researching, they've been adjusting things, and they're still stuck. Right? Still not feeling great. And if that's you, I'm going to tell you it's not your fault, because that's exactly what happens when the root cause gets overlooked. And I know that root cause term it's thrown around too much, but if you continue to ask why, and then ask one more why, you'll be shocked to find out how often you come to an adrenal fatigue problem. And I'll define what that is, because adrenal fatigue is ill-defined. People don't understand it. Even people that believe in it don't understand it, this broken stress response system. And I'll talk all about that. And one of the best places to get more information is if you go to my YouTube channel and check that out, right? So if anything I say today resonates with you a little bit, tuck that home, right? Tuck that in and accept that and realize, okay, maybe some of this stuff makes sense. Okay, so as you join in, welcome. I'm glad you're here. I really am. I mean, we do these conversations, have these conversations to educate and inform the public, right? So as you join in, just let us know where you're from. If you're international, awesome. Same thing. We've got patients all over the world. So bring in, and if you comment, my team is in the comments. So if you comment international, it'll give you some ideas to international programs that we have. I do have to say that this information is for educational purposes only. The content is not intended to substitute for medical advice, diagnosis, or treatment. Always seek advice of your medical doctor or healthcare provider with any questions that you have regarding your medical condition. Now, if you are a current patient in either my Core Plus coach-driven training program or program with me, you are welcome to. I'm glad you're further educating and trying to understand everything that's going on. That's awesome. If you have these, like I said earlier, these conversations are more so for the public or people who are new to our community, right? Answering those questions. If you have a question, awesome. I'll put it in. My team will put it in at the end. And if I have time, I'll try to get to it. You know, but if you're a patient, you have access to us, right? You have access to me. You have access to the coaches. So use the group programs or the chats to be able to get those questions answered. And my team's going to add links in the comments. So pay attention to the comments, links to everything, right? To our new Facebook group, the hub that my coaches are putting on and creating, to our new revamped self-led core program, which is phenomenal. So good. If a self-led program is all you can do or all you need, then it's amazing, right? The information and the feedback has been so incredibly positive for that. You can also join the Healing Adrenal Fatigue Holistically Facebook group, which is a wealth of information there, and even get a complimentary call with my patient coordinator, Christine, who's been with us now almost 10 years. One of the most compassionate women I can even think of. Okay, so I want to get to your questions. As always, I'm going to connect the dots everywhere I can. And these symptoms can feel unrelated on the surface, but underneath, if you keep asking why, a lot of times you can kind of trace these things back to the same underlying stress physiology. And again, my YouTube channel is a great place to go. Without further ado, let me just check, make sure my team says I'm good. Okay. So Diane says, how is this condition diagnosed? That's a good question. Well, here's the first thing. We can't diagnose adrenal fatigue because the term diagnosis belongs to the medical community and they don't believe adrenal fatigue exists. That's unfortunate. So if you go to your endocrinologist or your GP or whoever and you say, I think I have adrenal fatigue, how do I diagnose that? They'll probably laugh you out of the office. If they do a test at all, they're going to do a blood cortisol test, which is not adequate to test this. If you go to an endocrinologist, they might do a stim test where they use a pituitary hormone to stimulate your adrenals. And if your adrenals are not completely failed, which is Addison's disease, if your adrenals are not completely failed, you will pass that test. All my patients pass that test. In lieu of that, nothing's positive. They're going to say you don't have adrenal problems. Go see your psychiatrist about your anxiety or depression, right? Go see somebody else about your thyroid issues, your ovarian hormone issues. Here's a neurologist, here's the immunologist, all that stuff, right? So anyway, all these things are tied together, and I hope to explain exactly how and why they are. How do I assess this condition? I use salivary cortisol testing from a very specific lab, a lab I've been using for over 20 years now, which gives not just cortisol levels, right? You want to get free cortisol levels. That's what saliva provides. And you want a 4-point test because you want to catch it with the circadian rhythm. Cortisol creates that circadian rhythm. But you also want to get some other hormones, right? DHEA levels. We can get 17-OH progesterone. We can get insulins. So this test is a 10-point test that I use all the time, and that is what I've seen. So that is really the key. However, you can start with assessment with my symptom assessment tool, which is on my website. So we work pretty hard to create this probability index as to 4 or 5 minutes. You take this questionnaire. What is the likelihood I have adrenal fatigue? And it'll shoot you out a percentage and then give you some guidance and some information. Because literally, if it looks like a duck and walks like a duck and quacks like a duck, we often know what we're dealing with just from that. But you do want testing to, be able to treat more effectively. All right, all my best, Diane. Marta says, I just discovered I have adrenal burnout. Trying to reduce my stress, sleep better, eat better, vitamins, but it's not working very well. It's been 4 weeks already. Goodness, 4 weeks, and I'm doing everything. And I also stopped exercising and stopped being on a diet. When will it get better? Sorry, Marta, I'm sure you don't sound that way. My work and family suffers because of that, and I'm trying, but I still feel like I'm on the edge with everything. Okay, Marta, so there's a lot to this. And that's the reason I joke about it. I mean, with this thing, if you don't laugh about it, you're going to cry about it, right? So chances are, however you found out you have adrenal burnout, whatever that was, whatever that last thing that went into your bucket was probably the straw that broke the camel's back, the tip of the iceberg, so to speak. But that iceberg's been building and building and building for at least years, if not decades, which is why it doesn't turn around in 4 weeks. You have to keep doing all those various things that you said, and you want to do that, but it's been going on for so long, which is why it doesn't turn around, in a snap. Plus, I don't know if you've got a test, and I don't know if you've gotten guidance. We've been doing this a long time, and this is all we do. Call it adrenal burnout, adrenal fatigue, broken stress response. I don't know. Some people call it anxiety. So some people call it by their symptoms. Oh, it's just anxiety. Well, why? Dump adrenaline in your brain, you'll get anxiety. Anxiety, depression, insomnia, weight, blood sugar, blood pressure. Or they'll call it by the secondary. They'll tease out these secondary problems, the immune system problems, allergies, the digestive problems, the hormonal, ovarian hormones, thyroid hormones, all that stuff. It's all connected, right, to this main underlying cause, which is this broken stress response physiology. That involves your adrenals, but there's a whole lot more to it. And I mean, the bottom line, Mart, is most people need guidance. I learn things from YouTube too, right? And I like to fix stuff with YouTube, but I'm not going to take apart my transmission based on some YouTube video. You ever see one of those blowout things? It's intricate. There's a lot to it. And there's a lot to this as well. So, I mean, what I would suggest is, keep digging, keep looking, If you want to have a conversation, my patient coordinator, Christine, complimentary call, have a conversation. You can talk about kind of what the options are and whether we're a fit or what's going on. Get a feel. Get a feel for us. I mean, you get a feel for me here. I'm the same in my programs, on my group calls, on Facebook, on YouTube. This is, I am what I am at this point. So, okay. So Nita says, I'm having trouble grasping the link between stress and the thyroid gland. If you could explain that further, I'd be grateful. Sure thing. So it's simply cortisol, right? So what we know, and it's just endocrinology, like physiologic text. Now, I didn't learn this in med school either, unfortunately. Most doctors don't. But what we know is that excess cortisol, so cortisol is a hormone. I realize sometimes I talk beyond, like everybody understands it. So cortisol is a hormone, and hormones are released into the blood. And the blood goes everywhere, right? So these hormones go everywhere, right? Inside out, like head to toe, every cell, every tissue has receptors for cortisol. So one of the things, cortisol does many things, but one of the things cortisol does is it goes to the hypothalamus, the pituitary, and then the thyroid, and it suppresses it. It stops it. It blocks the production of the thyroid hormone in the hypothalamus that triggers the pituitary. It blocks the pituitary hormone that's supposed to trigger the thyroid, that's TSH. It binds up the thyroid. It blocks the thyroid receptors. So now you block T4 and T3. Cortisol blocks the conversion of T4 to T3, which is the more active form of that. Cortisol also, it goes so far as to convince the thyroid to release an inactive form of thyroid hormone called reverse T3, which doesn't work. Just in case it missed suppressing the thyroid anywhere else, it releases this inactive form of thyroid to bind up receptors to block thyroid hormone production. The number one cause of hypothyroidism in this country is going to go back to stress and cortisol. Diagnosably, the number one cause of hypothyroidism is Hashimoto's. That's an autoimmune thyroid problem. Same thing. Go back. That is going to come from stress physiology as well. Because now you have, let's say you have the suppressed thyroid, which I just talked about. Well, now if you throw, one of the other things cortisol does is it goes to the immune system and it causes the immune system shift, overproduce antibodies, and which means you can pretty much overproduce antibodies to anything. Allergies to the outside environment, food allergies, even an allergy to your body's own tissue, autoimmune disease. Combine that, you got Hashimoto's. So that's the connection, Nita. Even though I've been, even though I've only been in this group for a short time and on the core program for a week, you're sharing so much valuable information and I can't thank you enough. You're welcome. It's a small win, but even if I took a ton of supplements at night, I couldn't sleep. But now through pacing, supporting my vagus nerve, there's noticeable improvement. Awesome. That's so key, Nita, because I tell people all the time, like, I know you want the magic supplement. I mean, I just had conversation with my patients on our group calls today. I know you want the supplement for this. And we've all been programmed within this medical community or a paradigm of one drug for one disease. I have anxiety, take an anti-anxiety, it goes away. It's not that easy. I have depression, take an antidepressant. That model, that paradigm, it only works for the germ theory. Not for these chronic conditions, these chronic multifactorial conditions, right? That's the problem. So it's hard to wrap our brain around it. It's hard to extricate ourselves from this paradigm, this belief system that we've developed over decades where, let me just take this pill. So your experience is pretty common where the supplements alone don't work, right? Because supplements are just that. They're supplementary to all this foundational work, part of which is resting, pacing, vagus nerve exercises, relaxation exercise, all that stuff goes. So stick with that. It's awesome. So it's not your consistent, but I'm playing detective like you advocate. I now have hope. Phenomenal. Good for you. Keep at it, Nita. You'll get there. Deanna says, is there a connection between adrenal fatigue and adenomyosis? Can treating the stress response system, adrenal fatigue, help adenomyosis. So adenomyosis is not really fibroids, but the uterus. It's the uterine lining growing into the wall of the uterus, it's smooth muscle. So that uterine lining grows into it. And then, as you can probably imagine, if you have uterine lining, just like endometriosis, if it's somewhere it shouldn't be, it can cause swelling and pain and discomfort also. So I would put adenomyosis into the fibroid, endometriosis, PCOS, PMS, PMDD, dysmenorrhea, I would put all that into this estrogen dominant place. So estrogen relative to progesterone. That is the most common ovarian hormone problem that we associate with adrenal fatigue, with stress physiology, because again, just like I explained with the thyroid, that cortisol, when it's released in excess, goes to the hypothalamic pituitary ovarian hormone axis and suppresses it. Because who cares about reproduction when the body is perceiving a threat, a danger, a predator, right? Forget about that. Suppress that. It makes sense. Like your body's just in this protective mode. That's the same reason it suppresses the digestion. Like, don't sit down and have a bowel movement now. Like, there's a tiger in front of you. You'll be dead. So we turn it off. Immune system, chronic infections, forget about it. Don't. Sorry, that's New Jersey coming out. Don't waste energy chasing after some chronic infection. If there's a threat, conserve that energy, deal with the threat, and hopefully we'll shift back later, right? We'll turn off the wear and tear that comes from running from tigers all the time. We'll turn back on these healing and repair mechanisms, and then we live to fight another day. The problem is, and this is kind of the key, because this is what is not appreciated at the GP specialist clinical practice level, where that stress response system, with a bit of a vulnerability and just enough chronic stress over time to overwhelm somebody's bucket, it breaks. That's recognized in PhD level literature. They just use different terms. They don't call it adrenal fatigue. They'll call it HPA axis dysfunction. They'll call it hypercortisolism. They'll call it glucocorticoid resistance syndrome, glucocorticoid sensitivity, central sensitization. They'll call it allostatic load. All of these things are real things, but it's all sitting at this PhD level and hasn't gotten down to general practice where it needs to be. And I read all that literature. And these aren't theories. They start out as theories, just like the germ theory, right? They start out as theories, but these are well documented. And they're a problem because once that stress response system breaks, now you're stuck. Now it's almost like no matter what you do, how do I shift? I'm trying to shift, right? So the way you shift completely, and this is what I do with patients, right? Day in and day out, is you figure out what your therapeutic puzzle is for you, which is different than your neighbor, with regard to this specific condition. I'm not talking about puzzle pieces way out here, like, detox and all that garbage. I'm talking about, how do I fix this broken stress response system, the limbic system in the brain, the HPA axis, the autonomic nervous system, which all works together? How do I fix that system in this multifactorial, more of a holistic way, and get this to shift? And when you do that, you don't have to chase after everything else, right? You get this to shift, you turn off the wear and tear, and you turn on the healing and repair. That is what happens all the time in my practice. That's what we do. Whether it's with me, one of my programs, or with my coaches, I have less and less space in my practice, right? So I'm training my coaches. They know more about adrenal fatigue than any doctor you go to. My coaches have been patients. They've been through my program and have gotten better. They had previous nutrition or coaching degrees or whatever that may be. And then I put them through my adrenal health coach training program, and they got tons of experience, so compassionate. I'm blessed to have to the team that I have. Now, so some of the questions that you have submitted, they're hard to answer quickly. I don't know if I answer anything quickly. Things about patterns and reactions and which supplements to take and what's helping. So that's the kind of thing that we do work through on the consultation calls that I have, that coaches have, on our group calls, in sessions where we can dig deep, do deep dives into each individual's unique circumstances, because putting that puzzle together, it's not easy. It's not easy. It isn't, right? You can try, and you can try to do it on your own. And some people get a few pieces, right? You know, I happen to like puzzles. I tried to figure out my own puzzle. I went to med school to learn how to figure out puzzles. I actually studied from a puzzle master, did a residency under Dr. Posnacker before me. And since then, I've been putting these puzzles together with people, 8,000 over the past 20, almost 25 years. We've gotten pretty good at figuring out what that puzzle is. So the reason the programs work so efficiently is because we get enough time with patients to be able to put those puzzles together the fastest way possible. I mean, you can try to chip away at this, but you'll end up chipping away for years. Like, I don't know, it's been long enough, right? So, okay. Leela says, I've been getting severe itching, especially in the eyes, various food sensitivities, headaches, joint pain, weight loss as well. I have even tried to be dairy-free. It didn't help. What causes these, and what can be done to avoid these issues? Okay, so allergies, sensitivities, these are all associated with histamine issues, right? A lot of people are jumping on that bandwagon. Oh, I've got histamine intolerance, mast cell activation syndrome, mastocytosis if it gets really bad. Why? So this is me. Ask one more why. Why do you have histamine issues? Why is your immune system attacking food? Why did my immune system attack food? Right? Because food's not dangerous. The immune system, it's designed to sample our environment, right? Let's pick and choose. All right, I'm going to sample this. Nope, that's fine. Innocuous, no big deal. Pathogen. Okay, generate antibodies to the pathogen. So for some reason, our bodies have made a mistake. Now, the immune system, as it turns out, always makes mistakes. But there's a regulatory part of the immune system that knocks out that infection before it goes full bore. So what happens is we make increased mistakes with stress physiology. We make more mistakes. We don't have as much regulatory side of things. And all of a sudden we start developing allergies and sensitivities to things involving histamine. So histamine is one of these things that's connected to allergy, right? It's an inflammatory molecule. It exists in the blood, the cells, the brain even. So histamine's the problem, but there's a why that's deeper. So will I pay attention to histamine? Yes, a little bit I will. A little bit I will. Vitamin C is a nice histamine scavenger. I'll use quercetin as a natural antihistamine, nice and gentle, yet effective. But the key is to fix the underlying problem. I've had colleagues of mine do food allergies, right? We'll do food allergy testing. Oh, hey, you're allergic to gluten and dairy. You should probably not eat that. Okay, don't eat that. But what they don't do, and maybe the person feels a little better, but they don't address the underlying problem, which is this broken physiology. So what's going to happen now? You just develop allergies to the new groups of food you eat. So I've had patients literally come to me, and they've seen these functional medicine doctors and everything. They come to me like, I can eat like chicken and broccoli. Anything else I eat, I react to. Like, that's a tougher scenario for me, because now you're nutritionally depleted as well. We can still fix it. I mean, I see this stuff all the time. Ask one more why, right? Fix the underlying problem. Yes, go after the histamine. That's fine. Fix the why, right? Fix that broken stress response. All right. And good luck. Good luck to everybody, but Leela, good luck. And if you need help, and it's okay to need help, reach out, right? Reach out. Daniela says, hi, sometimes I've slept terribly. I have to get up around 5 a.m. 5 a.m. with a dry mouth. Need to eat something, a banana. This will calm me down, but I feel like this is counterproductive. Trying to fix insulin resistance feels like a terrible cycle. Okay, so maybe not. Sounds a little bit like hypoglycemia. Again, I kind of send you to the symptom assessment tool that we have. It's on my website, quick and easy, because there's other things, right? Like, is hypoglycemia always an adrenal problem? Often, more often than not, yes, but there might be other things. So take that assessment tool, and the majority of my patients have some degree of insulin resistance or metabolic instability in their system, because this adrenal hypoglycemia, which almost always happens because that's what cortisol does, it raises the blood sugar, puts a lot of pressure on insulin. And then that relationship is off, the blood sugar's off. Eventually you can overwork the pancreas. So all my patients need this hypoglycemic diet for quite a while. So we tweak that diet. But if you wake up in the morning, like even if you have a perfect snack before bed, by the time you wake up in the morning, like your blood sugar is going to have dropped. You got to eat something. So the banana is fine, but maybe you want to do a half a banana and like a scoop of peanut butter or an egg or something like that, right? Just to balance it out. But those things are fine. You can still get through it. Again, it's only one piece of the puzzle. Okay. Okay. So Chow says, have you ever seen a patient with normal testosterone and low DHEA? Yeah, totally. I don't really measure ovarian hormones, believe it or not, because oftentimes you can tell just by symptoms where those are, and they fluctuate, and we kind of know what's going on. The low DHEA is the tell. And so DHEA and testosterone are associated, so I can understand the question. They're both androgens, but they're not as closely associated as you would think. For women, most of a woman's testosterone actually comes from her adrenals, but that's a certain pathway. And there's a different pathway that goes to DHEA. Now, there's some, it's minor, interchange between DHEA being able to feed testosterone, but that's kind of minor. So there's a different pathway, that's all. So that's what's happening. But the low DHEA is the tell. And I tell people all the time, if I could only have one test, you're going to allow me one test to tell if somebody's got adrenal fatigue or a broken stress response system, DHEA is going to be that test. Because for someone to have a low DHEA, there's a world of hurt that had to go on in your body to get you to the point where your adrenals are not producing DHEA. And they'll always do it, right? Your body's going to defer to producing cortisol over DHEA when that DHEA comes down. And the lower it is, the more problematic it is, the more likely your physiology has been stuck in stress physiology for too long, which means excess wear and tear, not enough healing and repair. So this is it's a key marker. And it's not as easy as just, I'll just take some DHEA, it's low. Because yes, you can replace with some DHEA if you're a woman that tolerates DHEA, many don't. But replacing the DHEA doesn't fix the years, if not decades of damage that's caused which resulted in the low DHEA, right? You can replace thyroid hormone. That's easy. You can replace ovarian hormones. That's easy too. Not adrenal hormones. It's not that easy. So, and if that's confusing, I would strongly recommend a follow-up call with my patient coordinator, Christine, and we can help figure this out. Okay? All right. Good luck. Heather says, why would one have high blood pressure instead of low, which is more typical? Low is more typical for sure, especially in the early days. But all these stress hormones, they're vasoconstrictors, right? And what I said earlier, right? The hormones go into the blood goes everywhere. And when those vasoconstrictors hit your blood vessels, they constrict them. Well, if you do that enough over time, constrict, eventually those blood vessels can stiffen and then they don't relax quite as well. And now your blood pressure can go up. Right now, the heart's pumping the blood against a narrower tube, and we can see more elevated blood pressure. There's also like the sympathetic nervous system kind of is connected to your blood vessels as well. So that's a connection too. But yeah, so just because you have high blood pressure over low blood pressure, no. Any doctor worth his salt knows that somebody who has hypertension, 85% of hypertension, they call essential hypertension. What does that mean? We use these funny words in medicine. Essential hypertension. Essential is meaningless. It means you have high blood pressure. We don't know why, but we know, everybody knows that stress causes that over time, right? I mean, that's the result, but they don't know what to do about the stress thing. So they're like, let's just give you these antihypertensives and hope the blood pressure go down. And we'll just ignore the fact that you're still stressed out and still causing damage in your body. I mean, it doesn't make sense. So high blood pressure does not rule out adrenal problems. Oli Khan, pardon me. How's my time? Not bad. I say not bad. My team will let me know. No, it's bad. It's bad. Pardon me. Oli Khan. Okay, I have low cortisol level. Unfortunately, I'm suffering a lot. I'm sorry to hear that. I also have vasovagal. I think my immune system's attacking my brain. maybe not. Now, how can I increase my cortisol level? Okay, so so you're talking about cortisol. So 3 aspects of your stress response system: the HPA axis, which ends in the adrenals and releases cortisol. You're talking about your autonomic nervous system, the nerve that controls every organ in your body, including your vagus nerve. You mentioned vasovagal, so that's autonomic. And then you mentioned something in your brain. I doubt your immune system is attacking your brain, but there's almost always neuroinflammatory responses, because that's like cortisol is wonderful and life-saving, but it causes damage. And part of that damage is neuroinflammatory oxidative stress in the brain. So everything you're experiencing is accurate and describes what we see as a broken stress response system or adrenal fatigue. But your question now, how can I increase cortisol? There's no simple answer. Here, I'll just give you a pill. Or here, just take hydrocortisone. Don't do that. Don't do that. It's absolutely the last thing, last resort. You can fix it, but you've got to do all these things, right, that I'm talking about, which is doable. I mean, that's the beauty of me doing this for so long. And now I've been training my coaches to do this for so long. We've made all this and all this focus and somewhat complexity, that kind of a thing. We've drilled that down into a process, into a program, and we make it doable, right? If I stress patients out with my treatment recommendations, that's not going to help them, right? We're shooting ourselves in the foot. So we've made it doable in bite-sized ways, hitting it from all these various angles, focusing on what we have to focus on, letting go of the other stuff. So you can do it. Reach out. Reach out. It's okay to need help. It's okay to need help. And Christine can help guide you as to, what level of care you need, right? And what level of care you can manage, right? So, all right. Sarah says, how can we train our minds to be okay with wading through the plateaus of healing? Oh, I'm weak and shaky, and I wish I could be more positive and hopeful even while I accept it. Yeah, it's a tough thing, Sarah. It's a tough thing. So here and there, you don't have to be perfect with any of this, right? But here and there, you're going to be upset. You're going to be pissed off, right? That why me? You're going to do that. As long as you don't stay there, then you're probably going through the very normal process that all my patients go through, that we, support through this process. I don't know if you want to accept the level of dysfunction. We have to accept that this is where we are now. We don't have to accept that this is where we are going to be a year from now, but this is where we are now. And we have to accept that because we have to bring our life's demand down below that capacity. And then eventually that capacity is going to increase little by little. And, as my patients progress, the progression is up and out. The functionality is up and out. Some people faster, some people slower, but as long as it's up and out, we're good to go. And we just continue to look for ways to expedite the process. But it's never linear, Sarah. There are ups and downs through that process. The scary part of this, and again, this is kind of how I get, healing from adrenal fatigue is unlike healing from anything else. So one of the things I have to do in my program is kind of help people understand what healing looks like. Because when you don't know what it looks like, you can kind of jump ship and you can be frustrated. In this linear progression of functional increasing, you'll have these ups and downs. The hard part about the dips is that they feel like they did in the beginning. Now, I tell patients the symptoms will decrease. Little by little, they decrease in intensity, frequency, and duration. It happens with everybody. The dips, though, boy, they feel as intense for a while, for quite a while. They can feel as intense as it did in the beginning. But look at how, functionally you're higher. And functionally you're higher here. It just feels like it did in the beginning. And that's okay. So if you stick with it, right? When you have a dip and you tighten the reins and you do all those basic things again to get back, then you're good and you'll get there and you'll come up again. And eventually they feel less intense. Duration, frequency, we get smarter as we go through this process. What you also want to do is hold on to kind of the small wins, right? The glimpses of improvement, right? Because we don't all of a sudden shift this like, oh yeah, that's good. Just shift this, stop the damage, turn on the healing and repair. Now it's smooth sailing. It doesn't work that way. In the beginning, it's glimpses of feeling better. And then glimpses coalesce, they turn into moments. And now it's a minute. Now it's an hour here and there. And then it's a couple hours a week that we feel okay. Not great, but better than garbage. And then it's a couple hours a day, right? And then it's a couple days a week, right? And then eventually it's, most days a week, right? That's the progression. As long as, and the way I work with patients to do that is gain perspective. Take yourself off the ground floor, get a bird's eye view, 100-foot view of what does that look like? How did I feel? Could I have done that a month ago, 3 months ago, 6 months ago? And it's that perspective that's the tell. Okay. All right. So we got a handful more. All right. I think we're doing all right. Mohammed says, why do some people use pregnenolone or DHEA supplements if these precursors are supposed to balance out naturally after a period of healing? Yeah. So I use pregnenolone and DHEA in my patients, not all patients, but I will. They help. They can kind of speed up the process. They can support the system. They always come with a warning from me, like, okay, if you feel a little better on this, just remember that energy ain't yours. It's coming from that pill, which makes it, when it comes from a pill, it's real easy to overspend that energy, right? Just like a pot of coffee, that'll give you energy, but you overspend it and then you crash. Okay. So the pregnenolone and DHEA, they're okay when used wisely, and goodness knows that I have seen every tool in my toolbox used unwisely by other practitioners. When used wisely and appropriately at the right time, especially, they're useful tools. They're no magic bullet, right? But they're useful tools. Now, eventually, we want to build up support, let the adrenals heal, and then withdraw the support, because we do want the adrenals to function. So you're right. And you can do both ways. I have some patients that maybe those hormones aren't good for, but they can still heal too. Laura says, what is the best time to take Serophos? Before bed or when I wake up at 2 a.m.? Do I eat another stack at 2 a.m.? How long does the Serophos stay in your system? What should my blood sugar be at 2 p.m.? Okay, there's a lot of questions there, Laura. I am not your doctor, so I can't necessarily specifically answer those questions. But in general, the waking at night, very common symptom with this condition, is better prevented than to deal with it once you've woken up. We got to work on the preventative side, right? Because otherwise it's like you're trying to close the barn door after the animals already got away, right? Like you've already dumped a bunch of stress hormone because you woke. So we want to work on the preventative side. So, if I have a patient where I've done testing and I've done an assessment and Serophos makes sense, I will often use the Serophos in the evening to work on preventing the waking. I find Serophos to be very safe and effective. The waking at night is super common, often because the blood sugar drops. Again, prevention by balancing the blood sugar throughout the day, by having a good protein fat snack before bed, you can prevent one of the main reasons, not the only reason, but one of the main reasons for the waking at night. So it helps. Although, I have some patients, they're like, yeah, if I take a little snack at that time, it helps me get back to sleep better. Perfectly fine. There's no, we don't have pharmacological research on Serophos as far as the half-life of Serophos and all that stuff. But, when my patients get the right dose of Serophos, they can generally notice it, the benefit, if they do. Not everybody notices it, right? But within maybe 15 to 30 minutes. So it's hard to say about half-life. What should my blood sugars be at 2 a.m.? I generally don't take blood sugars. I don't like it. Those of us with adrenal problems, we tend to be cut from the same cloth, and we tend to be a little hypervigilant, right? So we tend to ruminate and stuff, perseverate and stuff. Like I don't like measuring stuff. I don't like measuring calories. I don't like measuring blood pressures. If I don't have to, I don't like measuring blood sugars. We can use this stuff to guide a little bit, right? But that's really about it. So you want to be cautious. So I generally don't test them. salivary cortisol through the roof at night and 3 years or longer. Yeah, it probably is, right? So, there's a lot there, Laura, and I understand, wanting and needing guidance with all of that. Reach out. We've been doing this a long time. And essentially what we can do is speed up the process, right? We can speed up the process. We can avoid the pitfalls, right? There's always going to be ups and downs, but we can minimize that stuff, right? So, okay, Kat says, I recently had DHEA test along with other hormones plus cortisol. Cortisol is high normal, DHEA slightly above normal, plus the indication of low metabolic issues common for adrenal fatigue stress. So adrenal fatigue is why the term is terrible, right? Because adrenal fatigue, the way I describe it is basically it's a broken stress response system. You can have high stress hormones, you can have low stress hormones, doesn't matter. So I have some of my patients, I guess technically they have adrenal fatigue, but they're in the early stage, they don't feel that tired because they're running on adrenaline all the time. It's the same underlying cause. It just looks different in all these different people. So quite likely, right? So quite likely. And again, check out that symptom assessment tool, right? That's a really useful tool. I like people to use it because I work my butt off putting that together. The logic and the process was crazy. But now it's this simple 4 or 5 minute test. Answer these questions, variety of questions, pretty easy to do. Spit out some recommendation and some supportive information. And you can always use that information, go to my YouTube channel and all that stuff. Now, ultimately, let's say you're kind of nodding your head, right? Or something I said sounds like you, right? Hey, I feel that. I sense that. Nobody really talks about that. It's not a coincidence. That means you're in the right place, right? That means you're in the right place to get guidance or support when it's needed. And it's okay to need that, right? And if you've been searching, like one of the things my patients will tell me is that, you've helped me to understand, you've given me a framework on where to put all these various things that are going on for me, which means I don't have to go down the rabbit hole and do the work my doctor's not doing because nobody's guiding me, telling me, oh yeah, that makes sense. Don't worry about that. Or this is this, and giving me a kind of a guide as to what to pay attention to, what not to worry about. I don't have to do late night Google searches all the time. So if it makes sense, stick around and reach out if you need any guidance. The Charming Nest that's cute. The Charming Nest does low DHEA and a sudden drop in blood pressure indicate adrenal fatigue. Both separately indicate adrenal fatigue. How's that? I keep hearing everyone talking about high cortisol. Yeah, cortisol goes up and down, sometimes high, sometimes low. Same thing with DHEA, high, low. I don't care if it's high, if it's low, you've got a problem with your adrenals. So cortisol should be in a range, right? It should be in a range in the morning, and then that range gradually goes down throughout the end of the day, and we should be in balance, right? So you should be somewhere in that range. None of my patients are, because when we use and abuse this system, the limbic system gets trigger happy. And what the limbic system's job is to do is to constantly assess our environment for danger. And now it starts to over-assess our environment as dangerous, right? We make mountains out of molehills. Minor stressors don't make a minor response, right? Major response, and we're in fight or flight, right? Just because it's something simple. That sensitization, that's what that's called. That central sensitization also happens in the sensory nerves, all the nerves. Sensory nerves included. So a lot of my patients are like, I'm sensitive to these bright lights now and loud sounds and harsh chemicals and smells, even touch. You can touch one of my patients and it registers pain, which happens to be fibromyalgia for anybody that's listening, that's been diagnosed or that's been given that, what I'm going to call a garbage can diagnosis. It's nice to call it something, but they have no idea what fibromyalgia is or what chronic fatigue syndrome is. So, yes, adrenal fatigue. Okay. Oh, you can't. So they said I had so many questions. And I answered a bunch of questions. And then they said, I have the same amount of questions. That's not fair. Ashraf says, too many words. Ashraf says, hi, doc. I'm 46, struggling with adrenal fatigue for 2 years. I have chest and left biceps pain. My cardiologist said it could be related to stress. Well, that's good. I know that adrenal fatigue can lead to cardiovascular complications, but I don't know what kind. What to do, please and thanks. Well, most of my patients have cardiovascular symptoms, which are scary, right? Anything that affects the heart is going to be scary. So we go to get it checked out. Let's go to the cardiologist. And most of the time, you get a clean bill of health. Your heart is healthy. You're fine. No problems whatsoever, which is good. You want to rule out all that stuff because that's what they're looking for, dangerous stuff. So chances are it's just more of a functional problem than it is a cardiovascular problem, right? Stress hormones are going to hit your heart. They're going to make the heart speed up or slow down. Like they hit the blood vessels and do all that kind of stuff as well. What to do? Go back and listen to this recording about what to do. That's the to do. There's a lot to do. There's a lot you can do. And there's a lot to do. And there's a lot for me to do to help people, get people back. But you can't. All right, Carrie Lynn says, I would like to know, even after 2 years of healing my nervous system, calming my system down 90%, that's awesome, Carrie Lynn. Why am I still so super sensitive to supplements and foods, high and low temperatures? I'm grateful for all the progress I have made, but these are sticking points. Okay. There's always sticking points. There's always those lingering symptoms, right? Because over time, symptoms should decrease in intensity, frequency, and duration, right? But it takes time. And then there's a few remaining. I still have this brain fog thing or whatever it might be. So the sensitization, right, to supplements, which is a very common problem, right? Dr. Posnecker said, and I agree, if you had to describe somebody with adrenal problems with one word, that word would be sensitive. We tend to be on the sensitive side. On every level you can think of, yes, that's what I'm talking about, sensitive. It takes a while to rewire that. It does. It takes a while. The immunologic sensitivity, the hormonal sensitivity, the temperature sensitivity has to do with the brain. That's up in the limbic system. And I suspect a lot of this stuff is up in the limbic system, which is where that sensitization tends to hit. So when I reassess my patients, right, could be at 4 weeks, 12 weeks, could be at 6 months. I'm always looking at the puzzle, the big picture, paying attention to symptoms, really main towards that 3 to 6 months. And then I'm thinking, okay, well, what else do I need to tweak? Like I visualize in my head this puzzle. There's a lot of different puzzle pieces. Do we have to tweak this? Do we have to make this one bigger? Are we missing any of those puzzles? So that's kind of what I do on the regular, Carrie Lynn. So I don't know if you were associated with us or a program or something, but there's no harm in, reaching back out if you are, and, getting a reevaluation or, jump back in again just to reassess. Something's, as long as it's progressing, it'll continue to progress. But I'm always about like, how do I expedite that, right? How do I speed this thing up, right? Most patients agree. And if you need help with that, just reach out again. Christy says, issues with B vitamins, methylation. Is this common in adrenal fatigue? How do you help with this? Do you help with this in your one-on-one? Too many B vitamins, give me tremors. Yeah. So the B vitamin sensitivity is a fairly common problem. So too are methylation issues. I mean, you look at the population and 2/3 of the country has some degree of methylation issue, but 2/3 of the country doesn't have this problem, right? So is there an association? Yes, it's a loose association. Do I pay attention to that aspect of things? Yes, I do. But that's not the main problem. Plus the fact that a methylation issue is a genetic predisposition, but there's percentages. You have this percent chance to do, and those percentages are manipulated by epigenetics. This is what more people need to talk about because it's the epigenetics that control the expression of your genes. Your genes stay fixed. We have our genes, but we don't express all those genes. Genes are blueprints. We don't read all the blueprints all the time. When you're in fight or flight, you're going to read a specific set of blueprints that is targeted at battle, war, energy, and all that. But let's say you're not in fight or flight. You've turned off that wear and tear. Now you've turned on the healing and repair epigenetics. Now your cells are doing maintenance. They're breaking down broken things, and they're detoxifying and they're processing. And you've switched methylation genes on and off based on the epigenetics, this physiology. So trying not to get too caught up in that. And if this all gets confusing, reach out, right? Reach out and talk to us. Again, Christine is my patient coordinator, been with me for a long time, so she knows how to guide. Glitz and Glam says, is psoriasis common during adrenal fatigue? Never had it before, and it just appeared my abdomen and back. Yeah, psoriasis, autoimmune. I see autoimmune conditions all the time. What nobody really does is think about the why. It's like, okay, why do I have an autoimmune condition? Why is my body attacking my own tissue? And depending on which tissue is being attacked, we give it different names, right? If it's the skin, it's psoriasis. If it's joints, it's rheumatoid arthritis. If it's the thyroid, it's Hashimoto's. If it's, you name it, right? All these autoimmune, but the same underlying pathophysiology is the immune system shift where we're increasing antibodies. Okay, so that's the why. But why? Why is the immune system doing that? What controls the immune system? I'll give you 3 guesses. First 2 don't count. The stress physiology. We know this. This is so well documented in the literature. And you don't believe me? I mean, dig. Like I research all the time. And I'm happy to do it. I love it. That's what I do for fun. I know. So if you don't do that for fun, you can just agree that, okay, that makes sense. Or you can dig in and find the research yourself. That's the problem. That's what you have to fix. Don't go chasing after, immunosuppressants. Like the conventional treatment for autoimmune disease is rough, but you can fix it. Okay. Carl says, I have a high-pitched whining tone in my brain, not my ears. Does this relate to years with adrenal fatigue and cortisol deficiency? Yeah. So I've been doing this long enough to realize that my patients have a lot of weird neurological symptoms that are associated with the neuroinflammatory process that comes from this stress physiology, oxidative stress, inflammation, nervous system rewiring, right? That combination causes some weird things, weird perceptions, and people describe them in interesting ways for sure. And that's one of the ways. Because this stress physiology control, and this is going to be the reason I sigh, this is going to be bold, but it controls literally everything else. All of our organs, all of our systems are wired to this stress physiology on purpose, right? If there's a tiger, you have to turn on your heart, your lungs, your metabolism. You got to fight. You need fuel. And at the same time, you're going to turn off non-essential things: immune, digestive, ovarian hormone, thyroid hormone, detoxification, maintenance. Who cares, right? Hair growth, nails, forget it. And then, right, once you survive, you want to shift back. So you want to turn off the overuse of these organs and turn on the healing and repair mechanisms in our body, right? Every cell, every tissue, every organ is involved in this process. That's why all the symptoms are so crazy and diverse. And I know that sounds wild, but if you just think about that process, I mean, that's how it works, right? So can it affect the brain in a weird, adverse way? 100% it can, but it's fixable, right? It's fixable. My patients have all kinds of weird neurological stuff. So Christy Hill says, I've been doing well on your program. I just had a pet die. Oh, I'm sorry. I feel like I'm starting all over again. Haven't felt this bad in months. Any advice? All right. So first of all, reach out, right? You did my core program. You can always kind of jump back in, get your feet back under you. And this is why So the original program I did for this was 12 months. I would have people commit, right, to 12 months with me before I had coaches, 12 months with me, and we would go into it and we would dive, because it takes that long to go through the process, to go through some ups and downs like you're going through, Christy, to realize, oh, I'm just in a dip. And this dip, it feels like it did in the beginning. And then we have to convince our crazy limbic system, which likes to worry and fear things, right? Okay, I'm not at the beginning. I don't have to start over. I'm going to come out of this faster. I'm going to get back on my feet, right? But that requires some, I don't even call it hand holding. It requires some support and guidance through that. So that's okay. So reach out. Okay, Donald says, my adrenal saliva is fairly unremarkable. DHEA is low, 50 milligrams of DHEA along with recommended supplements, but energy not. Okay, so here's the thing, Donald. I'm hoping you were around earlier, because you cannot replace DHEA like you replace all these other darn hormones. It doesn't work, because for your DHEA to become low, everything else had to fall apart for years prior. And just replacing the DHEA doesn't fix all those years of damage. That is fixable, though. But what it requires is consistently turning on the healing and repair more than the wear and tear for long enough for you to recover. Energy is interesting, right? Energy is connected to cortisol, but it's also connected to, again, the wear and tear, right, of oxidative stress damaging the mitochondria. Just about all my patients have mitochondrial damage. You can't fix the mitochondria if somebody's still in fight or flight, right? It's like trying to bail a boat and you haven't patched the holes. I mean, you're not going to get very far. So the key is to shift this physiology. I don't care if you turn the wear and tear down to 49% of the time and your healing and repairs on 51% of the time, you'll catch up. It'll take some time, right? Be faster if you could go 40, 60 damage repair. This is not easy to do, right? Which is why I have these programs, whether it's with coaches or with me, to guide patients on how to do this. What this feels like is calm. Calm, peace, serenity. That's what I want my patients to feel. The more we feel that, the better. If there's anything that helps us to feel that, do more of that. And if there's anything in our life that takes us away from calm, peace, and serenity, if it could be negotiated away, we reduce it, minimize it, eliminate it temporarily, you should absolutely do that. And I'm talking, that's physical, mental, emotional, spiritual, toxins in the environment, jobs, to-dos, the news, forums. Oh my goodness. I use Reddit sometimes, less and less, because it gets a little bad. The only social media I use is Reddit, because I like Jeeps and I like to look at the Jeeps and certain boots and things like that, right? It makes me happy, right? So, but here and there, there's a CFS subreddit that I pay attention to, and it can be challenging, right, to be on those groups, because you've got a bunch of people that are suffering so terribly, and I want to grab them and help them understand that this condition I'm talking about, it is a piece of their problem. And there's been research on this, and it's been documented. People forget about it because there's no drug, right? There's no drug for adrenal fatigue. There's no drug for chronic fatigue either, of course, and there never will be. But that's the paradigm that we're all stuck in, right? We're waiting for somebody to save us, and we need more research, right? We need more research for chronic fatigue, for long COVID, for fibromyalgia. We need more research for adrenal fatigue, this broken stress response. We need it all. But in the meantime, when we fix the adrenal fatigue problems, we set up a strong foundation to be able to move forward. So that's my goal. So Donald, I would say hang in there. Replacing with DHEA, good. Go back right? You say Core Plus Pro, go back through those modules. Make sure you're checking off all the boxes as efficiently as you possibly can. Sometimes we think we are, but maybe we could use a little work because they're all important. They're all important. Hang out and reach out to us if you need any other guidance. Now, I can't always get to every question, of course, within these events, but again, if something helped to bring some clarity to you, right, or if you help to recognize one of your own patterns, it's a good thing, right? And it might be time to take the next step. With the right information and the right support and guidance, you can get through this, and you can get through this efficiently. You really can. I mean, I had a patient just a couple of weeks ago. She went from 10% functionality. I mean, she was literally shut down. We talked, guided. 3 months later, 70%. 70%. Now that's fast, right? If I shouldn't compare patients, right? But if I put everybody on a bell curve, like that's on the fast side. But that's how it can happen. Now, she was good. I mean, she's got training in this stuff. She's got education in these things. She knows how to do relaxation exercises. But what we were able to do is kind of dial this in. Let's put all these pieces together. Let's fix. You're missing this one. You're missing this one. You're missing this one. And man, she was off and running. So this doesn't have to take years and years, right? It really doesn't. But it does take some time and some effort, and it takes knowledge, and it takes often guidance and support. Guidance and support. That's what we provide. We've been doing it for a long time. I'm happy to help. If you need anything, if you need any support whatsoever, please feel free to reach out. Okay? All right. All my best to everybody. Take good care.